Hello everyone, my name is Melissa Domcheska and I'll be presenting my health campaign on improving mental health services in the Latino population using the social cognitive theory. To begin, mental health in the Hispanic Latino population is a highly stigmatized topic. There are various social determinants that affect this issue, such as misunderstanding about mental health, privacy concerns, language barriers, lack of health insurance, a misdiagnosis, faith and spirituality, and legal status. For example, Latino communities are more likely than Caucasian communities to reach out to church and religious leaders for help with personal problems. Also, a study by the Kaiser Family Foundation in 2017 found that 19% of people identifying as Hispanic or Latino in New Jersey had no form of health insurance. Latino immigrants may also be afraid of applying for aid, such as through the Affordable Care Act, because of concerns around legal status. In addition, only 1 in 3 Latino adults who need mental health treatment receive it. This is below the United States national average of 43%. To begin my health campaign, I broke down the campaign into 3 goals. The first goal involves improving mental health education and awareness by providing education and awareness about the normalization of mental health in schools. Also by providing parent, guardian, adult workshops about the available resources in the community and providing culturally competent information to reduce stigma. Goal 2 would include improving access to these mental health services, such as educating religious and spiritual leaders that are already pillars of support and trust in the community, collaborating with health agencies, local alliances, community-based organizations for support and referrals, and also utilizing these resources to translate materials. Goal 3 is broad, and it involves strengthening family and community relationships by collaborating with stakeholders to host community events, working with local clinics and healthcare providers to provide complimentary mental health screenings, using appropriate channels to spread the message where the message will be seen by the target audience, and providing workshops about the Affordable Care Act and other insurance options. A basic literature review found that there was a foundation for this issue. For example, an article suggested that addressing the social determinants of health that contribute to mental health is just as important as those that lead to this lack of mental health services. A second article found the importance of non-sector community-based organizations. These organizations were critical in providing advocacy, adult learning, after-school programs for youth, legal aid and immigrant advocacy, insurance status, proof of legal status, and language proficiency. These organizations alone targeted many of the social determinants that are seen as barriers in the Latino population to mental health care and access. The third article focused on e-health technology for community-based interventions. This article focused on a peer-to-peer and a parent-to-parent way to identify mental health issues in their youth using technology. A website was constructed to train for self-efficacy and be able to navigate technology with peer support. I use the social cognitive theory because of its basic foundation of reciprocal determinism, which is a relationship between 3 factors of interpersonal factors, the environment, and behavior. These 3 factors all lead into each other. For example, the environment can influence the person's behavior, which in turn influences how they see things in their interpersonal factors, and so forth. There is also observational learning and modeling, where role models and the consequences of what these role models do, behavioral capacity, or having the knowledge and skills to perform a behavior change, self-efficacy, or the confidence and ability to change, output expectations, which ask the questions, is what I'm doing worth the effort, and reinforcements, what will help the behavior continue. My campaign strategy involves hitting multi-level sectors, for example, creating posters in schools for youth, administration, and parents to see, trainings and events hosted by trusted members of the community, again those faith-based leaders, to lead to observational learning and modeling. Free trainings and workshops can offer knowledge and practice of skills for the behavioral capacity. A trusting relationship with healthcare providers and clinics can increase patient satisfaction and self-efficacy in being able to identify and do something about a potential mental health issue. Utilizing those CBOs or community-based organizations is critical because the community can realize that the agencies are there to help regardless of barriers such as legal status or insurance. This can lead to positive outcome expectations. Providing gift cards for grocery stores, public transportation, and childcare can also lead to positive reinforcement of behavior. If the community experiences positive outcome expectations, then that can lead to self-initiated reinforcement. And while collaborating with the environment community can lead to stronger relationships and reduce stigma of mental health in the Latino population. Here are some examples of the media sources I created for this campaign. These green posters signify the green color of mental health and can be put up around the community and in schools. This flyer advertises an event sponsored by a local church. All of these materials would be translated into English and Spanish to be as culturally competent as possible, using religious leaders and other people of support in the community to help translate and create a connection with the target audience. My evaluation strategy will answer two questions. First, was there a change in knowledge and awareness around mental health in the Latino population? Second, was there a change in the utilization of services around mental health? Evaluation would need to continuously occur to adjust and improve the campaign. These can include monthly surveys, monthly focus groups, and listening sessions to bring the target audience to the table. Some questions that would need to be answered is the campaign reaching the correct population? Can the campaign be more culturally competent? What does the target audience wish to see more of? What supplementary support can be provided to help the target audience? And what will incentivize them to attend an event, program, workshop if they have not done so already? By bringing the community and the target audience to the table and utilizing role models and community-based organizations, working collaboratively, there can be an increase in mental health education and advocacy and an increase in the utilization of services in the Latino population. Thank you.